Here at UT Southwestern at Children's Health, we take care of patients with all kinds of cleft deformities, including cleft lip or cleft palate. And it's a really common facial difference that can affect a lot of patients. It happens as often as 1 in 700 patients. And so we see quite a few patients with these differences here in our cleft team. The beauty of the cleft team here at UT Southwestern is that we're a multidisciplinary center where we have all of our providers in one setting. And so it makes a much more streamlined experience for our patients and our families who can come in and see all of the providers that they need on the same day. And we formulate a plan together to make sure that our patients are getting the best care possible. Additionally, another diagnosis that we treat here commonly is craniosynostosis. So that's the premature fusion of one of the many cranial sutures or the growing centers of the skull. And sometimes in some patients, those sutures can fuse early, preventing the skull from growing, making space for the brain. So here at Children's Health, we can help to take care of that surgically through a number of operations that exist. And we have the ability here to offer both some of our minimally invasive operations or some of the more traditional remodeling operations. So we offer all of the different operations possible here for craniosynostosis. Thinking about cleft care, one of the things that are important is making sure that your cleft surgeries are done appropriately at the right times. And so part of our team here is to help coordinate your care from birth and even before birth. We have a number of our patients who establish care with us before their child is even born. And so it's great to have a neonatal consultation where we can talk a little bit about what to expect coming forward, the different operations that your child may need, and how our team can help you navigate that. Classically, when we think about craniosynostosis, the operations that were offered were large, bony remodeling surgeries where we take apart the skull and put it back in the shape that we want it to be. Now, with some of the innovations that exist in the field, including things that have been really pioneered here at UT Southwestern, we're able to do less invasive operations earlier on with smaller incisions and shorter surgeries that allow our children to go home faster and have a less invasive operation. One of the benefits of our team here is that we have a craniofacial orthodontist on the Cleft and Craniofacial team, and that person can help to offer pre-surgical molding before we do a cleft lip repair. That oftentimes can give patients a better long-term both aesthetic and functional result. So we oftentimes will begin with nasal alveolar molding here at our center before a cleft lip repair. We typically are working with the timing of around 3 months for initial surgery for a cleft lip repair, and a cleft palate repair is done somewhere after 9 months of age. Once those initial surgeries are done in the first year of life, we follow our patients along annually to see when they're ready for the next operations. And ultimately, they graduate from our center after they turn 18 and they're ready to enter adult care. The timing for cleft surgery is really important because it affects the functional development of those children. And so we think about getting a lip and a palate closed in time before a child usually turns 1 to try and maximize their feeding abilities and their speech development. But here at our center, because we're a large referral center, we oftentimes see patients who didn't have their initial treatments in that timeline, and that's okay. We are well equipped here to handle those situations and get us back on track to give us the best gains that we can have. When we talk about cleft lip repairs, because these are operations that are done when our patients are quite young, we typically like to keep our patients in the hospital for at least 1 day. During that time, we help to make sure that their pain is adequately controlled and they're back to drinking enough to make sure that they're hydrated by the time they go home. But usually, by the first day after surgery, our patients and our families are ready to head home. It's the same thing with cleft palate repairs. Usually we have our patients stay 1 night, again, to make sure they're back to feeding and hydrating appropriately, and that their pain is well controlled and the families feel ready to take them home. Usually we'll see you a few times afterwards to help ensure that the scars are healing well and help guide things with scar care like silicone products or sunscreen that can help affect how the scar looks long term. The importance of cleft palate surgery is based on a number of things. So the palate has a lot of important roles in the function for your child, one of which is affecting their speech development. And so as children are getting close to the first year of life, they start to babble and they start to generate sounds that ultimately becomes their speech. Having a cleft palate there can prevent them from developing normal speech. So it's really important to get that cleft palate repaired in time so they can then go on to develop normal speech that allows them to communicate with us as they get older. Facial trauma is something that affects a lot of people, and it's actually quite common both in pediatric and in adult populations. Being a level 1 trauma center here, we're very familiar with how to take care of children with facial traumas, and we see quite a bit of that here at our center. It's really important to work on taking care of both the patient, but also helping our families cope with this, because oftentimes it can be a difficult time to adjust to a child who's had these traumas. Surgically, we often will correct the bony skeleton of the face to try and get the skeleton back into appropriate alignment to go on to have the best functional restoration and also the best facial cosmetic and aesthetic result possible, because we're thinking about long-term rehabilitation and going back to normal function for these children. Here at our team for managing craniosynostosis, we have a multidisciplinary team that involves both our neurosurgery colleagues and our pediatric craniofacial surgeons. So I work with specifically pediatric neurosurgeons who specialize just in the management of craniosynostosis. And together, we devise a treatment plan that helps take care of our patients. These surgeries can oftentimes be quite complex, and based upon the diagnosis that a child may have, they may require multiple surgeries to get them to the best cranial result possible. The surgeries that we offer are both minimally invasive and our regular open cranial vault remodeling operations. Additionally, we involve interesting technologies like craniofacial distraction techniques that can help to slowly, progressively expand the skull. And some patients in certain settings may benefit from different treatment paradigms. And so because of that, I work with our neurosurgery colleagues to devise a tailored care for each patient based on the diagnosis they have and the goals that we have together.